Good evening to everyone and welcome to today's wonderful discussion. I'm sorry I had been indisposed for the past 4 or 5 days. We could not have the discussion. But still we have 15 more days of time, which is wonderfully sufficient enough to summarize and get ready to the expectations of the examiner. So with that preamble, let's make the great beginning of the today's session. Bharadam and many more who are all online. So I hope you all took the test so that it will be very interesting, because this acts more like a discussion of what you already have attempted in the morning. Now, doctor, keep punching your answers along with me so that it will be very interesting, the discussion. The intercostal nerve and the vessels in the costal groove, what is the order in which they are arranged? From above downwards. The vein, artery, and the nerve is one of the favorite questions of the examiner. Greater splanchnic nerve, lesser splanchnic nerve. Can the online students punch whether the voice is loud and clear for all of you? What is the root value is a favorite question. T5 to T9 is greater, T9 to T12 is lesser, and L1 to L2 is least. It is called 4-3-2 rule. Accounting to the number of ganglia giving rise to each nerve. So T5 to T9, 4. T9 to T12, 3. L1 to L2, 2. These are the number of ganglia that give rise to greater, lesser, and least splanchnic nerve is what you need to remember. I leave the literature for you to do the revision. Duodenum, what is characteristic feature, doctor? The glands of Brunner in the submucosa. That's what our biology teacher taught us, in fact. These are the Brunner's glands, doctor. So tomorrow's NEET PG exam, one MCQ sure shot. Image-based MCQs come from the histology is what you need to remember. So what are the various things in the auditory pathway? Medial geniculate body, trapezoid body, inferior colliculus, but lateral lemniscus, not medial. So what is carried by the medial meniscus? Medial meniscus carry karega, doctor. You remember dorsal columns, right? Dorsal columns carry the vibration, position, touch. These are carried by cuneate and gracile. So typically in the spinal cord, ipsilaterally they will pass up to the lower part of the medulla, and there they will undergo decussation and descend up in the form of medial lemniscus, which is carrying the touch and vibration by these dorsal columns of the contralateral side is what you need to remember. So lateral lemniscus is involved. So the sound touches the auditory nerve, from there the journey to the cochlear nuclei, and from there to superior olivary nucleus, to lateral lemniscus, to inferior colliculus, to thalamus, and from thalamus it goes to the auditory cortex is what you need to remember. Now, doctor, lateral spinothalamic tract lead to contralateral loss of pain and temperature, but one segment below the level of the lesion. That's what you need to remember. So all these questions, doctor, let me tell you, मार्च 5th हमने शुरू किया up to April 15th. So totally 40 days. 40 days, 4,000 MCQs. Sure short MCQs. जरूर आने वाला टॉपिक्स है, जरूर आने वाला क्वेश्चंस है, इसलिए मॉर्निंग टेस्ट ले लो और शाम को डिस्कशन में शामिल होना. And try to identify 5 to 10 topics where you are going wrong. That is how you have to build your confidence every day. So ATP binds to the myosin. So the myosin, ATP hydrolysis will cause the release of energy, and that will lead to the caulking of the myosin head. And the myosin typically is now available to bind with the actin. So this is how the muscle contraction cycle in the skeletal muscle. You should remember everything. So ATP का जरूरत क्या है? वो क्रॉस ब्रिजेस को ब्रेक करके उसको फ्री करने के लिए. And why do you get rigor mortis? Because in a dead person there is no ATP available to lead to the dissociation of myosin from actin. That's the reason it will be in a rigor mortis. So what is the primary neurotransmitter of the raphe nuclei? Primary neurotransmitter. Just 1 minute, let me change this video. Yeah. Now, good to see 11 online classmates. I'm really sorry, last 4 or 5 days I could not give my time. But yeah, the remaining 15 days I am promising you that I will be coming online every day and we will take up 100 MCQs discussion every day. Now, the primary neurotransmitter of the raphe nuclei, it is serotonin, which is most important. So the cell bodies which are containing acetylcholine, where do you find them? In the basal nucleus of Maynard. And whenever the basal nucleus of the Maynard is degenerated, that lead to decreased acetylcholine, which is implicated in the Alzheimer's disease, is what you need to emphatically remember. In the bone marrow, myeloid to erythroid ratio normally kitna hota hai? 3:1 is what you need to remember. So where will hypoxia lead to vasodilatation? In systemic circulation. In systemic circulation. Whereas it leads to vasoconstriction in pulmonary circulation. Pulmonary circulation is what you need to remember. Spermatogenesis and oogenesis. What is similar? Basically, the DNA replication occurs during the meiosis. That is a common thing in both spermatogenesis and oogenesis. In the oogenesis, the meiosis begins before birth and arrests between birth and puberty in prophase 1. Whereas in spermatogenesis, the meiosis does not begin until puberty, is what you should remember. A 4-year-old retarded child, mental retardation, biting his fingertips, self-mutilation. It is the characteristic feature of HGPRT deficiency. Hypoxanthine guanosine phosphoribosyl transferase deficiency, which is called Lesch-Kanihan syndrome. Lesch-Kanihan syndrome is what you need to remember. Now, doctor, DNA synthesis produces many short fragments of DNA that have the RNA sequences at their 5 ends because of a mutation. So, whose mutation is that? So, you should know everything about what is DNA polymerase 1 doing, 2 doing, ligase doing, helicase doing, dirase doing, blah, blah, blah. So, DNA polymerase 1 kya karega? It removes the RNA primers from the 5 end of the short Okazaki fragments is what you have to remember, the DNA polymerase 1. DNA gyrase is a type 2 topoisomerase found in the E. coli. DNA helicase. Helicases will bind to single-stranded DNA near the replication fork and force the double strand apart, making room for the synthetic enzymes to act. So that is the function of the helicases. I leave the literature for you to be very sure. Now, purine biosynthesis is controlled by which enzymes? Which substances that will cause a negative feedback inhibition? Once more, purine pyrimidine biosynthesis. Don't forget, doctor, Incus app download karo. Biochemistry में जाना, purine pyrimidine का revision करना. The job of a teacher is more than teaching, to remind you to read, to remind you to focus, to remind you to emphasize. Oh, hey, hamara kaam. Right, doctor? So that is the reason, Tasmat Jagrata Jagrata, said Shankaracharya. So you are preparing for an exam. It is like a neurosurgeon operating very close to the spinal cord. No scope for any errors. Even you also, like a neurosurgeon, precision. How will you get precision? If you are limiting yourself to a limited number of topics. Remember? Then you will get precision. That's what I want to tell you. So, you should know that 5-phosphoribosyl 1-pyrophosphate. It is catalyzed by PRPP synthetase. Whenever there is a very high concentration of the nucleotides, it becomes inhibited. Because end products always come back and inhibit the initial reaction. Barabar? Very good. End product feedback inhibition data. So end product क्या है? Nucleotides. So that nucleotide will come back and tell that initial enzyme PRPP synthetase को क्या बोलेगा? अरे PRPP synthetase. Already lot of nucleotides are produced. Why you want to work? So it will come and inhibit it. So end product always lead to feedback inhibition is what you need to remember. Similarly, ADP, AMP, they also will cause inhibition of this PRPP synthetase. Whereas inorganic phosphate, whenever it is in high concentration, it will activate. So that is what you should remember. So all this biochemical reaction, doctor, totally 15 biochemical reactions. You have to be 100% sure. So पूरा बायोकेमिस्ट्री में कितने क्वेश्चन आएगा कल के नीट पीजी में बोलो? 5 to 6 क्वेश्चन आएगा, 5 to 6 क्वेश्चन आएगा। और बताओ वो 5 to 6 में क्या आने वाला है? Glycolysis, gluconeogenesis, glycogen synthesis, glycogen breakdown, citric acid cycle, like that. Beta oxidation of fatty acid synthesis, cholesterol metabolism, purine biosynthesis, pyrimidine biosynthesis, uric acid production, and the urea cycle. Tips में बोल सकते हो. हर एक reaction में what is rate limiting enzyme? What are the substrate level phosphorylation steps? Everything कड़क रहना. डॉक्टर मुरली भारद्वाज स्टूडेंट बोले तो एग्जामिनर को शिवरिंग आना. अरे क्या बात है, हमारे बाप निकला है बच्चे, हाँ, और बहुत अच्छा लिख रहे हैं. So that is what the purpose of any coaching program. I am so happy, so thankful to all of you. मेरे प्यारे भारतवासियों, पूरा भारत आप एमडी बनने के लिए वेट कर रहा है. एमडी बनो, अमेरिका मेक्को जाना, भारत में प्रैक्टिस करो. और बहुत लोग आपके, there are pregnant women waiting to get delivered in your hands. There are little babies with pneumonia want to be ventilated by your hands. There are many elderly people with the stroke waiting to be treated by you. There are many people with an impending heart attack waiting for you to be a cardiologist. So think like that when you start your preparation. No, don't get biased. Oh my God, क्या होगा, क्या होगा, क्या होगा. No, कुछ भी नहीं होगा. अगर आप कुछ पढ़े तो, कुछ एक्शन करे तो रिजल्ट आएगा. फिक्र में से क्या आएगा? कुछ भी नहीं आएगा, और ज्यादा फिक्रेंगे हम. ठीक है? So that is very important, doctor. Electron transport chain carriers, where are they located, doctor? They're typically located in the inner mitochondrial membrane. Once more I want to tell you, what are the inhibitors of electron transport chain? Favorite MCQ of the examiner. Liver and heart. Which shuttle pathway is utilized to produce ATP from NADH? Malate aspartate shuttle. So you should remember, this shuttle will enable the circulation of NADH produced in the cytosol to go into the mitochondria को carry करने के लिए, because mitochondria को पहुंचे तो, if NADH reaches the mitochondria, then only it will convert into energy. So somebody should carry. That's how all the shunts came into place. Malate aspartate shuttle is utilized in liver and heart, so that NADPH is converted into ATP. The main challenge is this mitochondrial membrane directly NADH, if it wants to come into the mitochondria from cytosol, it won't let it to come. So it requires a carrier. So oxaloacetate is converted into malate. In the process, NADH become NAD. Malate comes back comes into the mitochondria, or convert back into oxaloacetate. Oh. One minute, doctor. I think your broadcast में बहुत गड़बड़ हो रहा है. Yeah, I think now it is better. Yeah, now it is little better, right? Sorry. So this is how the shunt basically functions. Neisseria, gonorrhea. What is the medium, doctor? What is the medium of Neisseria, gonorrhea? Hair Martin is the isolation medium. Vibrio parahemolyticus. It is a human pathogen, halophilic, lactose negative, sucrose negative, causes the GIT disease. If you happen to eat the seafood, is what you need to remember. Streptococcus pyogenes produce erythrogenic toxin that lead to the signs of scarlet fever. Legionnaires disease, how do you diagnose, doctor? You need to identify that specific antigen which is there in the urine is what I want to underscore to all of you. Yeah. Now, is the broadcast fine? Yeah. Which fungi can lead to granulomas? Coccidioides, blastomyces, histoplasma, they're all known to lead to development of the granulomas is what you should remember. Now, doctor, how to recognize Candida albicans, yeast and pseudohyphae? If you give a drug intravenously, what is the effect of it? Bioavailability will be 100% if you happen to give it intravenously. Muscarinic receptors, bronchial or smooth muscle. What is the effect? They will increase the IP3 and diacylglycerol. So you should know very well parasympathetic, sympathetic, where are they located and what is where is norepinephrine working, where is the acetylcholine working, what are the favorite areas of examiner. Nicotinic acid, if you happen to give, that decreases both the plasma cholesterol and triglycerides. Generally, most of the drugs, statins, everything, what do? They decrease only cholesterol, they don't affect the triglycerides. So, typically, niacin, nicotinic acid can decrease both the plasma cholesterol and the triglycerides, is what you have to emphatically remember. Which drug blocks the potassium channels and responsible for the cardiac repolarization and also blocks the calcium channels in the AV node? So, amiodarone has multiple functions, doctor. Remember one thing. If amiodarone is in the options, amiodarone is the answer. Don't tell Murali Bharadwaz teach like this. But after watching entrance exam game for the past 22 years, what I understood is, if TB is in the options, TB is the answer. That's what you need to remember. So everything, anything about amiodarone. एमिडारॉन का साइड इफेक्ट्स क्या है, एमिडारॉन का मैकेनिज्म ऑफ एक्शन क्या है, सब कुछ पढ़ के जाना एग्जाम को. विल यू प्रॉमिस मी? एमिडारॉन जिंदाबाद फॉर नीट पीजी एग्जाम. विदाउट ए क्वेश्चन ऑन एमिडारॉन अगर एग्जामिनर क्वेश्चन पेपर दिए तो आई विल गो टू कोर्ट ऑफ लॉ. राइट? डेफिनेटली आने वाला शूट शॉट टॉपिक लिख लो. नाउ बोथ फिनाइटो एंड कार्बोक्सिलिक, व्हाट इज इट? They both prevent the sodium influx through the fast sodium channels. Once more, doctor, antiarrhythmics as such. Classification of antiarrhythmics. पढ़ लिया क्या? सब कुछ सीख लिया क्या एंटीरिथमिक्स के बारे में? सोचो, डीपली सोचो, क्योंकि शुद्ध शॉर्ट आने वाला क्वेश्चन है एंटीरिथमिक्स. A patient suffering from ADHD is placed on atomoxetine. How does atomoxetine function? Atomoxetine functions very similar to amitriptyline is what you need to remember. So atomoxetine, it blocks the reuptake of norepinephrine into the nerve terminals. That's what you need to remember. Chronic granulomatous disease, CGD, is because of deficiency of NADPH oxidase. Once more, doctor. Chediak-Higashi, Wiskott-Aldrich syndrome, chronic granulomatous disease. All these things, 100% you should be sure when you are going for the exam tomorrow. So NADPH oxidase converts oxygen to superoxide and stimulates the oxygen burst is what you need to remember. A growth factor that is capable of inducing angiogenesis. Which one? It is the basic fibroblast growth factor. A 4-year-old oculocutaneous albinism, neutrophil count is found to be decreased. Ineffective bactericidal capabilities. Defective fusion of the phagolysosomes. Typically, what is your answer? Chediak-Higashi syndrome is what you need to remember. So, Chediak-Higashi क्या होता है? What is the inheritance pattern, doctor? Autosomal recessive disorder. Abnormal fusion of the phagosome with the lysosome. Ineffective bactericidal capability. Giant intracytoplasmic lysosomes. Abnormal melanosomes leading to oculocutaneous albinism is what you need to remember. Acha, doctor, this is another favorite topic, sure short topic, complement pathway. अगर आप नहीं पढ़ाई करें तो अभी जाओ पढ़ाई करो. Incus ऐप को डाउनलोड करो. Incus ऐप में आपको सब कुछ मिल जाएगा. 2000 HD videos are available, doctor. Whichever topic you want to do revision, आपको 20 minute, 30 minute का revision video is available. बराबर? So every day you have to identify. by मैं Incus ऐप में full scale grant test ले रहा हूँ 100 क्वेश्चन वाला. कितना क्वेश्चंस रॉन्ग गया देख लेना. देखने के बाद शाम को 6 बजे को मुरली भरद्वाज के साथ डिस्कशन में शामिल होना और 10-15 टॉपिक्स को डिसाइड करना और बैठ जाना और रिवीजन करना. मार्च 5th to April 15th, 40 days में if you identify every day 10 topics where you are बुरी तरफ घायल हो रहे हो, wherever you are getting injured by the examiner, identify them and then go back and do the revision. You do this process religiously. अगर टॉप 1000 रैंक्स में नहीं आए तो मेरा नाम मुरली भरद्वाज नहीं है. बराबर? So, doctor, alternate complement pathway versus classical complement pathway, दोनों के बीच में क्या फर्क होता है? What is the difference between the two is an important question. Very simple, doctor. अगर आप classical pathway देखें तो it is the antigen antibody immune complex which initiates it. And typically the alternate pathway, alternate क्यों बन गया? Alternate pathway does not involve any of these early components of the complement pathway. It does not involve C1 or all these early components. It does not involve. वो सीधा आके alternate pathway is affecting the C3. It is not involving any of these early components. डायरेक्टली आके C3 को अटैक करेगा। इसलिए द क्लासिकल पाथवे वर्सेस अल्टरनेट पाथवे देखे तो alternate pathway, the early complement components are bypassed and C3 is activated directly. That is the reason the early complement components C1, C4, C2, they are normal. They are not decreased. Only C3 is decreased. Whereas classical complement pathway mean the early complements are also decreased. That's what I want to underscore to all of you. Now, doctor, marked thickening of the basement membrane, glomerular basement membrane, kahan hota hai? Where do you see? Typically, in the diabetes mellitus, SLE, membranous glomerulonephritis, Kibelstein-Wilson's lesions of the diabetes mellitus, thickening of the GVM. In malignant nephrosclerosis, अगर बीपी बहुत चढ़ गया, बीपी कंट्रोल नहीं है, अगर नहीं है तो क्या होता? Malignant nephrosclerosis होगा. Malignant nephrosclerosis में there will be small petechial hemorrhage on the surface of the kidney, and that is called flea-bitten kidney. Flea-bitten kidney is what you should remember. Now, strychnine, how does it act, doctor? It acts on the anter cells of the spinal cord. Glycine is the major postsynaptic inhibitory neurotransmitter. Strychnine and glycine act at two different binding sites in an allosteric manner. So, strychnine acts mainly on the inhibitory synapses in the ventral horns. So, fecundatio ebextra, उसका मतलब क्या है? If the person, instead of ejaculating with a penile penetration into the vagina leading to pregnancy, if he happened to deposit the semen on the thighs or on the vulva without penetration, but the sperms started swimming and swim and reach the egg and fertilization ho gaya, pregnancy aa gaya, not by the penile penetration but by depositing the semen outside the vagina. That is called fecundatio ebextra. If a man has a sexual intercourse even with his own wife without her consent, who is living separately, mere aankhon se dafa ho ja, get out of my eyes, she said. And she went to court of law. I don't want to see this man. His mouth is smelling, nose is flowing. I don't want to live with him. But that guy came, used his power on her like an animal and tried to have intercourse with her. Then usko le jaake jail mein dalega. 2 years imprisonment and fine under section 376A of Indian Penal Code. A large bruise. How does the color change? It changes from the periphery. It begins to change from the periphery first. Periphery first. If the maximum breadth of the skull is B, length is L, maximum height is H. What is the cephalic index formula? B by L into 100. You have to be 100% sure. Early diagnosis, treatment. होता है secondary prevention. So leprosy, malaria, TB, you can do that not in the case of the measles. What is the depth of the water in water seal type of latrine? देखो भाई, ये latrines का depth कितना होता, कितना तक पानी रहता, this will decide whether you become a cardiologist, neurologist, nephrologist, plastic surgeon or anything. So इसलिए don't tell I enjoy learning. You are forced to enjoy learning. There is no other way. So, how much depth of water should be there in the water seal type of latrine? You have to run to the washroom in the exam hall and then need to check sometimes. 7.5 centimeters, doctor. Now, Sling psychrometer, where do you use? Percentage of humidity in the air. Accredited social health activist आशा का eligibility criteria क्या है? कितना compensation देते हो? ये सब चीजें हमने बहुत दिल लगा के डिस्कशन किया डॉक्टर. Please go back to the Incus app. Go to the 2000 HD videos covering 953 high yield topics from 19 subjects. You have wonderful content available on the Incus app. So please go back. And mock test should act as an inspiration for you to prepare, to know where you are going wrong. That is most important in preparation, doctor. She must be resident of the village. She must be graduate in any stream, preferably in science. She should be preferably married or widow or divorcee is more preferable. Typically in the age group of 25 to 45. RCH2, strengthening the referral services, operationalizing the first referral units. There are certain strategies that are laid under RCH2. एक बार revision करो. Commonest complaint of women fitted with IUD क्या होता है? Bleeding is most common. जननी सुरक्षा योजना में क्या होता है? The woman must be more than 19 years, mostly available for first 2 live births, belongs to below poverty line, scheduled caste, scheduled tribe. That's what you need to remember. So what is fourth stage of demography cycle? Low birth, low death. Point source epidemic में no secondary waves. Within a specified period, it happens like Bhopal gas tragedy. All cases occur abruptly and simultaneously. Between first and third quartile, so you have divided the data into first quartile, second quartile, third quartile. So typically, in a 300 observations, how many observations will be there? So first, second, third. So first quartile, third quartile के बीच में 50% डेटा रहता. कितना रहता? 50% डेटा रहता. So totally 300 है. 300 by 50% कितना है? 150 है. 150 observations. Once more, doctor, on the Incus app, you have 20 videos of 20 to 30 minute duration on biostatistics, जहां हम totally we have taken around 300 MCQs and discussed in 20 videos biostatistics in Incus app. मैं आपको बोल रहा हूं कम से कम एक बार वो आप सुनना है ये 20 वीडियोस को, HD वीडियोस है PSM में, वो रिवीजन करे तो कल के नीट पीजी में गारंटी, सीट गारंटी. नाउ age correction is applied to which statistical test of significance? Chi-square test. So you want to prevent overestimation of the statistical significance whenever the data is small. So whenever you are using the chi-square, you use the age correction. So bar graph, spot map, pie chart, ये सब चीजें क्वालिटेटिव, स्कैटर होता है क्वांटिटेटिव. क्वांटिटेटिव is what you need to remember. A 68-year-old retired professor of medicine noticed worsening problems to maneuver. He has a particular trouble getting out of the squatting position. That means proximal muscle weakness. Proximal muscle weakness है तो इंडियन टॉयलेट रहता है ना, वहां स्क्वाटिंग पोजीशन से उठना मुश्किल होता है. थाइस, बटक्स, दे बिकम वीक. डिस्टल मसल वीकनेस है तो टिपिकली with your fingers, whatever you have to do, like unbuttoning, buttoning the things, or sewing, or combing. Of course, combing you require shoulders, proximal muscle. And the feet, there will be tripping attacks, fall downs. The person will be falling down if the distal muscle weakness is there. So that is what you need to remember. So doctor, 49-year-old, pain radiating to posterior aspect of his left leg. Strength of bowel and bladder is normal. That means it is a case of radiculopathy. Radiculopathy होता है LMN में होता है hyporeflexia. So it is Achilles tendon reflex, S1 narrow root compression is what you need to remember. So the most common location for the lumbar disc herniation कहाँ होता है? First lumbar and first sacral. Fifth lumbar and first sacral. And between fourth and fifth lumbar is what you need to remember. So doctor, this is one of the favorite questions of the examiner, which you need to remember. So for every level, how do you do localization? You do motor testing, reflex testing, sensation testing. Tibialis anterior is motor. Knee joint is the reflex. And the big toe hota hai L4 and L5. You can see all this area, big toe is L5. L5 is a big number, no? Little toe is S1. 1 is small number. So extensor hallucis longus, there is no reflex for L5. For L4, you have the knee joint. And the sensation is along the front of the foot involving the big toe is what you see with L5. Then S1, it is the peroneus longus and brevis motor. Achilles tendon is the reflex. And the little finger, little toe is the S1 is what you need to remember. A patient with bilateral posterior fossa masses with cephalate spots. Family history of bilateral hearing loss at a young age. Obviously, it is a case of neurofibromatosis. So, it is the chromosome number 22, type 2 neurofibromatosis. A pure sensory stroke is because of a lacunar stroke into thalamus. Willenberg syndrome is because of pica, posterior inferior cerebellar artery, which is the branch of the vertebral artery. Mild mental retardation, deep red discoloration, port wine nevus कहाँ होता है? Sturge-Weber syndrome में होता है. So they will have a leptomeningeal angioma. So this is MR venography post contrast. You can see the presence of the angioma. So this is the T1 post contrast is what you are able to see. Now doctor, the patient has intractable complex partial seizures. Cortical dysplasia, left temporal lobectomy. After surgery, what will happen? Temporal lobectomy करे तो superior quadrant anopsia होगा right side में, left करे तो. Whereas parietal lobe involvement will lead to inferior quadrant anopsia is what you need to remember. So all these things are very standard questions, doctor. Nothing dupe about it. कल के एग्जाम में if you keep a surprising face, no, एग्जाम में competition, cutthroat competition है. So all these standard things examiner is going to ask, you have to prepare. Of course, 20-30 questions, complete bakwas questions होता है. So those things are equally bakwas for everybody. But 170 questions, predictable questions, sure shot questions. That is the reason I am advising all of you, भैया March 5th से April 15th तक daily 100 MCQs के हिसाब से 4000 MCQs. We have a discussion, we have a mock test available in the Incus app. आप अच्छा दिल लगा के रोज एक टेस्ट लेना और शाम 6 PM को मुरली भरद्वाज के साथ बैठ के डिस्कशन करना और 10-15 टॉपिक्स को पकड़ लेना और कल के एग्जाम को जाना. बराबर डॉक्टर? Epidural hematoma typically will be biconvex in shape, biconvex. Whereas if it is subdural hematoma, typically it will be like a sickle-shaped long bleed, and it is a venous bleed, subdural hemorrhage. Whereas epidural hemorrhage होता है arterial bleed, and there is a lucid interval. This is what you need to remember. Headache, fever, disorientation, seizures, acute encephalitis. When you see an elderly person, temporal lobe involvement, hemorrhagic infarction, hemorrhagic encephalitis involving the uncus of the temporal lobe. That is the function, that is the property of herpes simplex virus encephalitis is what I want to underscore to all of you. That's the reason always viral encephalitis means there is increase in the number of lymphocytes. What is the most common site for the abscess formation in the brain? Dr. Gray-White junction is the most common location. The pain of the MI is typically induced by exercise and relieved by rest. Slow rising pulse is a feature of aortic stenosis, not mitral stenosis. I'm running fast because all these things many times we discuss. My job is mainly to give you the clue, important clue about the answer. I'm trying to run fast. Please don't mind about it. The normal JVP falls during inspiration because inspiration will create negative intrathoracic pressure. So if you look at the heart, right atrium goes into right ventricle, SVC, IVC, they drain into RA. So whenever negative intrathoracic pressure is created by the inspiration, it will suck the blood from the great veins into the heart. So the great veins and the JVP, they all collapse during inspiration. If they don't collapse, and JVP remained prominent in spite of inspiration, that is called Kusumal sign. When will that happen? If during the time of inspiration, if the heart is having a thick pericardium, which is preventing the inflow of the blood into the heart, the blood remains in the jugular veins. That leads to a prominent jugular vein at the time of inspiration, which is called Kusumal sign, which is the hallmark of the constrictive pericarditis, is what I want to underscore to all of you. So, reversed splitting कहाँ होता है second heart sound का? Normally, doctor, the left ventricle, right ventricle में left ventricle aortic valve closes first. Then pulmonic valve closes. So A2 is followed by P2. But if there is a left bundle branch block, the closure of the aortic valve becomes delayed. It becomes so delayed that it occurs after P2. That's called reversal splitting. Now, softening of the first heart sound is a feature of MR, not MS. MS में loud S1 होता है. Now, the different adverse effects. Imidazole lead to photosensitivity, verapamil lead to constipation, and digoxin lead to acute confusional state. They're all true. And imidazole lead to corneal microdeposits. That's what I want to underscore to all of you. In a normal ECG, PR interval, how do you measure? Not from the end of P wave, from the beginning of the P wave to the beginning of the Q wave, you call it as PR interval. Cannon waves, where do you see? We see giant waves in tricuspid stenosis, right? V waves are prominent in tricuspid regurgitation, right? Inspiratory rise in the JVP called Kusumal. You see it in pericardial tamponade, right? But cannon A waves होता है, conditions leading to cannon A waves. So you should tell me, when will A wave occur? So typically A wave in the JVP occurs during when the atrium is filling into the ventricle. In the last 1/3, atrium contracts to push the blood. But if there is a AV dissociation, the valve is closed when the atrium is contracting because of the dissociation. So then what will happen? It will go and hit the closed valve, and that will push the pressure back into the JVP, leading to cannon A wave at the time of atrial contraction. During the last 1/3 of the ventricular diastole, when the atrium is contracting against a closed AV valve, because of the AV dissociation, it is hitting a closed wall, and that leads to the pressure back transmitted into the jugular vein, causing the cannon A wave, is what you need to remember. Now, doctor, in a patient with atrial fibrillation, alcohol abuse is one of the important causes. Pulse is irregular, and you need to first anticoagulate before giving direct, doing the cardioversion. In megaloblastic anemia, what do you see? Anisocytosis, poikilocytosis, neutrophils will show hypersegmentation of the nuclei, pancytopenia, and you will find reticulocytopenia, decreased reticulocytes, because of the ineffective erythropoiesis that you see in the case of the megaloblastic anemia, is what you need to remember. Howell-Jolly bodies can also be seen. Ovelocytes, macrocytes can be seen. Hemolytic anemia, megaloblastic anemia, myoplasma pneumonia. So anything about hemolytic anemia, you should basically remember. Polycythemia rubra vera, उसमें lab score, leukocyte alkaline phosphatase score को क्या होगा? Lab score is increased in polycythemia rubra vera, whereas lab score is decreased if it is leukemia. That is the importance of lab score. Acute renal failure, Urine osmolality will be more than 600, means it is pre-renal failure due to hypovolemia. So once more, one of the favorite questions is pre-renal versus intra-renal versus post-renal failure. How do you differentiate the three? Favorite question. लिख लो, definitely आएगा. Long-term dialysis करे तो MI, carpal tunnel syndrome, high output congestive heart failure, etc., etc. Fanconi syndrome में proximal renal tubular dysfunction will be there. So that lead to aminoaciduria, hypophosphatemia, hyperuricemia is wrong. Proximal renal tubular acidosis will be there. So proximal RTA, glycosuria, decreased phosphate, decreased uric acid, decreased potassium. Myeloma kidney typically lead to proximal RTA, multiple myeloma, not distal RTA. Provocative test to identify prolactin deficiency, we use TRH. That is TSH releasing hormone. Hyperphagia, obesity. Once more, doctor. Fatafat bolo. Sure short. MCQ in the NEET PG क्या होता है? If you don't read this topic and go to the exam hall now, Murali Bharadwaz soul will be heaving restlessly in the graveyard. Hypothalamic nuclei, favorite topic. You should not miss it. So, doctor, you should know ventromedial nucleus lesion will lead to hyperphagia and obesity. भाई आप एक कार को इमेजिन करो, हाइपोथैलेमस को इमेजिन कर सकते हो. You can remember, if you imagine a car, one of the favorite mnemonics during the USMLE preparation, anteriorly the radiator is there, which is meant for cooling. So anterior hypothalamic nucleus cools. Sunroof होता है suprachiasmatic. So circadian rhythm, सूरज चांदनी आना जाना रात और सुबह, sunroof, suprachiasmatic nucleus. Laterally the gas cap, this is where you put petrol. So lateral hypothalamic nucleus is important for hunger. Then medially you have the gas tank into which the petrol goes. So satiety, amma, I am full, tank full means satiety. Medial hypothalamic nucleus. Posteriorly is exhaust. So heating is posterior. Cooling is anterior. This is what you need to remember. So lateral area, stim the lad, get the fat. Stimulating the lateral increases the hunger inhibited by leptin. We'll just take 5-minute break, doctor. Five minutes break. Stay online. Download Incus app. Daily full-scale mock test discussion. At 6 p.m. Right, Doc? Just please stay online 5 minutes. I'll join you back. So welcome back to the session, Doctor. I hope you all picked up that cup of tea and ready for the finishing of the remaining 40 questions. So what is important is patience, perseverance, focus. That is the most essential thing to become the NEET PG Topper, Doctor. You should know what you are reading. You should know what are your areas of strengths and real areas where you need to do all that finishing job. Very important. So that is the reason I say every day as you wake up in the morning, you have 100 MCQ full scale grand test available. Solve karo. 70 out of 100, for example, you are right, or 60 out of 100 is your score. Still 10-15 topics pakdo. Arey bhai, main kahan wrong ho raha hu? Just go back to the video library. You have 2000 HD videos, revision karo. और शाम को डॉक्टर मुरली भरद्वाज के साथ फटाफट रिवीजन में पार्टिसिपेट करो. 100 questions. I'm not just giving these questions like that. They're all hand-picked questions. Short questions going to come. Exact replica in the tomorrow's NEET PG. You need not worry. If you are able to follow with me all these 40 tests from March 5th to April 15th, 4000 MCQs का मेरे साथ बैठ के रिवीजन करे तो सीट नहीं आए तो मेरा जिम्मेदारी. I guarantee you. Only thing you should promise me is after every test you identify by hypothalamic nuclei, for example. If you did that question wrong, you should think, because it would definitely aane wala question hai. Similarly, nephron physiology, short question. Ovarian carcinoma, carcinoma cervix, breast carcinoma, short topics hai. Almost 170 out of 200 questions उंगलियों में गिन के बोल सकते वो आ रहा है बोल के. So you have to attack the examiner. You should not be submissive to the examiner and defensive. You must be attacking. That's what the whole purpose of these daily evening sessions. Thanks for joining. Every day, please join. Now, Doctor, let's continue our journey. So, ventromedial nucleus. Stim the ven, get thin with leptin. Thin with tin, leptin. So stimulating ventromedial increases the satiety. Stim by leptin is what you need to remember. Then anterior nucleus, remember AC, anterior hota hai cooling and parasympathetic. Posterior hota hai shivering, sympathetic. Watch your back, fight or flight is what you should remember. Next, suprachiasmatic, circadian rhythm. You need to sleep to be charismatic. Dorsomedial, damn, mean, meaty, savage and fat. Paraventricular, para is parturition, parents, oxytocin. That's what you need to remember. Melatonin mellows your pining for sex. From pineal gland, it inhibits the anterior pituitary release of LH, FSH, so it suppresses the libido in winter. That is melatonin. Pre-optic, seeing somewhere pretty gets your gonads going. So it releases the gonadotropic hormones, LH and FSH. So what is the order in which the hormonal loss occur whenever the pituitary is damaged and there is a hypopituitarism? Is a very important question. First GH, FSH, TSH, then ACTH. GFTA is the order in which pituitary damage, hormonal loss will be. Isolated elevation of alkaline phosphatase. Typically, hyperthyroidism, not hypo. Similarly, diabetes, Hodgkin's, IBD, anything cause a increase in the alkaline phosphatase, which is a very non-specific marker. Interferon therapy, kab dete ho, chronic hepatitis B में. If there are HB, the replication marker, there is envelope antigen if it is positive. If he is immunocompetent, or if he is HPAG negative chronic hepatitis, but if already liver decompensated, there is no point in using interferon therapy. So what do you use, doctor? Pegylated interferon, PEG interferon therapy. Intraventricular hemorrhage in a newborn. Basically, it is a venous infarction. It is asymmetrical lesion and venous infarction. That is intraventricular hemorrhage. In right ventricular, in tetralogy of Fallot, there is a pulmonic stenosis leading to right ventricular hypertrophy. Agreed. Transposition of blood vessels, there is a right ventricular hypertrophy. So the right-sided leads क्या है? V1, V2. Left-sided क्या है? V5, V6. Whenever the T wave is upright in V1 after 72 hours of age, that is how you recognize right ventricular hypertrophy. Whereas what happens in tricuspid atresia? In tricuspid atresia, right atrial blood is not going to right ventricle at all. Why will right ventricle hypertrophies? It doesn't. Similarly, mitral stenosis mein, left atrial blood is not going to left ventricle at all. That is the reason pure mitral stenosis mein left ventricular hypertrophy nahi hoga. Similarly, tricuspid atresia jab hota hai, right ventricular hypertrophy nahi hoga. These are the classical dictums of the cardiology. Patent ductus arteriosus. When will you perform the ligation of PDA? Typically between 1 to 2 years. 9 months baby. If he doesn't put foot in the mouth, if he doesn't change the objects from one hand to other, he need to sit unaided. If he doesn't, then that is a worry. But pincer grafts does not develop before 10 months is what you should remember. By 10 months of age, symmetrical forward parachute reaction typically happens. He'll be able to localize the sounds, move around the crawling or bottom shuffling, thumb apposition on both hands, etc., etc. This is a beautiful question, doctor. Once more. लिख लो भैया, लिख लो आपके 100 pages notebook में लिख लो. Sure short topic for NEET PG exam. कल के एग्जाम हॉल में मुरली भरद्वाज याद आएगा. अरे सर ने उस दिन डिस्कस किया बोल के याद आएगा. Right? So you should know everything, anything about proportionate, disproportionate dwarfism. What are the causes? Everything you should know, doctor. So I'll take a few extra minutes of your time to make you alert about this topic. Achondroplasia, congenital hypothyroidism, दोनों में limbs will grow slowly because of the epiphyseal dysplasia. Whereas in delayed adolescence, growth of the long bone will continue for longer period, so that normal body proportion. In pituitary dwarfism, emotional deprivation, there is no growth hormone, but the body proportions are normal. So first of all, this is one important MCQ you should remember, doctor. Sure short question. At birth, what is the length? 50 centimeters. 1 year it is 75, 2 years 87.5, 3 years 93.75. Growth velocity is 6 centimeters per year, and 4 years it is 100 centimeters. 8 years 125, and 12th year, by the time it is 12 years, 5 feet height आना चाहिए. That is the important bit. If somebody did not achieve 30 centimeters, by 12 years you need to work. Short stature can be dysmorphic or normal. Short stature है, dysmorphism भी है तो think of Russell-Silver syndrome, Noonan-Turner, Prader-Willi, pseudo-hypoparathyroidism, ये सब आपके मन में आना चाहिए. 1 minute डॉक्टर, जरा ये इंटरनेट इधर उधर गड़बड़ कर रहे हैं. Hope we are back into the transmission. Yeah. So once more, doctor. Whenever short stature is there, you should think of dysmorphic or is it normal? If it is dysmorphic, what are the possibilities? Noonan, Turner, Downs, Prader-Willi, pseudo-hypoparathyroidism, they're all responsible. If it is normal, then think of proportionate or disproportionate. All these osteogenesis imperfecta, achondroplasia, metabolic and storage disorders, rickets, they all lead to disproportionate morphism. Whereas constitutional, familial, IUGR, celiac disease, chronic malnutrition, chronic systemic disease, growth hormone deficiency, hypothyroidism, hypogonadism, all these endocrine causes, they're all proportioning is what you need to remember. proportionate. So I think our internet is very unstable today. Yeah. Hope it won't affect us. Yeah. Now, whenever you find a short change that looks normal, calculate TH. If it is not within the target range, watch the growth velocity. If it is a normal growth velocity, low birth weight, growth delay, and idiopathic short stature. If it is within target range, observe. If the growth velocity is normal, you need not worry. Then if it is a low growth velocity, then think of chronic systemic disease, endocrine disorder, genetic, chromosomal, or psychosocial. So you should know what are the causes of proportionate short stature. Familial constitutional growth delay. Even prenatal causes like IUGR, intrauterine infections, genetic disorders. Similarly, emotional deprivation and endocrine causes. They are all proportionate dwarfism is disproportionate short stature. All these mucopolysaccharidosis, mucolipidosis, they're all with short trunk. Whereas achondroplasia, dysplasia, refractory rickets, they're all with short limbs. That's what it is. So, doctor, another favorite question: familial short stature versus constitutional short stature. Constitutional is more common in boys. There's a family history of short stature, constitutional short stature. So, all these differences you have to be very sure about, doctor. Delayed eruption of the teeth can occur in dysostosis, whereas in ectodermal dysplasia, the teeth itself are totally or partially absent, is what you need to remember. So with this, we will conclude today's session, doc. And once more tomorrow, we'll catch up with a lot of energy, enthusiasm, which is fundamental to become a NEET PG topper. Good night and enjoy a great time of preparation.